Hey everybody, it is Taylor with Aspen Rehab. I am with one of our patients, Deb, today, and she just finished our prevention treatment. So we're going to hear Deb's story. It's very interesting. I can't wait for you to hear it, and I hope that we get this education out here for anybody that may have these same things happening to them. All right, Deb, tell me from the very beginning your story. I want our users to hear about this because it's absolutely incredible.
Thank you. I appreciate that. I was diagnosed with breast cancer back in 2004. Had a mastectomy on the right breast, had reconstructive surgery done, and a few months into it, I developed a Baker 4 capsule.
Okay, so I'm going to stop you really quickly. I don't know if you know what the Baker grade system is, but it's 1 through 4. 4 is the most aggressive capsule that you can get. It's usually it's hard as a rock. Is that how you felt?
Yes, it's harder than a rock. Okay. Terrible. Yes.
Painful, stiff, can't move.
Exactly.
So what did you do once being diagnosed with the Baker grade 4? Did you have a revision?
I did have a revision. As soon as I went back to my plastic surgeon to get my stitches out, lo and behold, the contracture was starting on the opposite breast.
Wow, okay.
Immediately.
Yeah, so we tell our patients that give us a call that reoccurrence rate is very high. So if you have capsular contracture and you've had a revision because the Baker grade was so intense, we definitely suggest getting the prevention treatment, and that's what Deb did here with us. If you don't get the prevention treatment here with us, you have a very, very high rate of re-encapsulating. We can treat existing capsules without having to go back into surgery, but with Deb's case, whenever it's so intense, sometimes surgery is the first option and prevention is the best way to go.
Absolutely.
Okay, yeah.
So when it happened the second time, I immediately came to Aspen and started the treatment.
Okay.
Which, thank goodness, I think time was of the essence, and because I got here immediately, it worked.
That's very true. So that's a good point. Time is of the essence. So like I said, we do treat existing capsules, but if you can get to us 2 weeks post-op, you can prevent any of these complications from even occurring.
Then my most recent visit here, over the span of 10 years,
Dang it.
I had a ruptured implant.
Okay.
So after, my breast surgeon discovered it, the only other option was to once again have revision.
Yeah, you have to replace an implant that's ruptured, of course.
So we had to. So considering my history, I was scared, obviously, of the contracture once again reoccurring.
Right.
So once I knew that I had to have the surgery, the first place I called was Aspen.
Right, you were very proactive. I knew that.
It's
yes,
like I had
absolutely.
to be. I'm very, very concerned about this. So it was at that time that I realized that you guys had developed a preventative program. And I'm like, praise God. So 2 weeks after surgery, I came, did the preventative treatment. Did my homework because that's very important as well. Do what you need to do, at home.
Absolutely.
And it's been since October, 3-4 months now, and I'm great.
Okay.
Thank God.
Thank God. So we're still good.
We're still all good.
Oh, I love that. So Deb was a patient of ours that did our existing treatment for an existing capsule. She was fine for 10 years, you said?
Yes.
Okay, 10 years she was great. Then she discovered a ruptured implant. Obviously, she had to have that replaced. Called us immediately, came in for the prevention treatment, had her surgery in October. She's still good to go, and we're looking to keep those results the same. We love her very much. She has been a part of our family here at Aspen for some time, and I thank you for doing this with us.
I am honored.
Yes.
I mean, you guys are the best. It's, if you ever need any kind of rehabilitation, call Aspen.
Thank you so much. And you can find us online at aspenaftersurgery.com. Our Instagram usernames are Aspen After Surgery as well. And you can call the front at 954-341-7875. Thanks.
Thank you.